Hi everybody, Michele Kunz here. I'm here to talk about taking Advanced Cardiac Life Support course. That's your ACLS. I just want to give you like an introduction on how to prepare for this heavy-duty, intense program. So it is usually a 2-day program, and there is a textbook. So you need to get the textbook, and the textbook is very good. There's a pre-test in there. There's a lot of information. So you need to know all of that. If you're taking one of my courses, you'll also be able to download from the internet, from my website, the study guide. The study guide condenses all what you need to know in a couple pages. So you really need to memorize, like the study guide, because it goes through every algorithm, it goes through every drug, it goes through preventing arrest, dealing with patients in CHF, patients with trauma. It goes through a lot of those things. It goes through all the drug doses. So memorizing the study guide is key to passing ACLS. The other thing that will help all of you pass ACLS is my new videos. And we're still making some, so it should be very helpful. Even the new nurses have told me taking their boards and their finals in their last year of nursing school, they found that the EKG videos really, really helped them. That, they've been learning EKGs for like 2 years in nursing school, and finally they understand that. So that was pretty nice to hear. So there's EKG videos, there's heart block videos, there's a couple of videos related to your ACLS class. So it would probably be helpful to you in passing ACLS. So when you do all the studying, you need to prepare this ahead of time, because it is an intense course. And there's testing in the program. At the end of the day, you'll have a written exam, and you'll also have what they call a mega code. Mega code incorporates all the skills that you might have been practicing all through the ACLS program, whether it's using the ambu bag, or we call it the bag mask ventilation, whether it's what drugs you will use for what arrhythmias, whether it's a patient that's in cardiac arrest, and how to use the defibrillator, the monitor, possibly pacemaker, all your American Heart Association classes, and probably your Red Cross classes also. I teach the American Heart Association course. Every course in an AHA deals with the AED, that's the automatic external defibrillator, and putting pads on. So it's a lot of skills, a lot of knowledge. Also, just remember, before you go to the class, get your ACLS card out if you're taking a recertification. If you're taking a certification or recert, you also need to bring your BCLS card with you. Most instructors should be asking for that when you come in the door. Some instructors might even test your CPR skills right at the door. So again, it sounds like it could be a stressful program. It is. But if you are prepared for that before you go, and you know what to expect, you feel a little better about the course. So bring those cards with you. Bring whatever study material you have, the textbook, the pretest answers that you selected, any questions you've had about that pretest, and then be prepared to take the course, which would include American Heart DVD type of videos, which are very good. A lot of instructors will add things to that program. I know in my class, I also have a slideshow, which I show basic to advanced EKGs. I find that just reviewing that makes you feel more comfortable when we get to the mega code and we work as a team. So in the mega code, which could be also a little stressful, everybody has to participate. And it may be a small group, you may be alone with an instructor, so you really have to perform. You have to be able to recognize the rhythm. You have to be able to assess your patients, whether it's their vital signs, their breath sounds, how they look, how they feel, and to express yourself on what you're looking for, how you're treating this patient, and what your expectations of that treatment is. So if if you say you're going to administer a drug, what you expect would happen for that patient. And if the instructor tells you, it is not correct, what would be the next thing that you would do? You could ask the instructor questions also to get more of a background to help you remember what to do. So it's coming prepared to class. It's getting information from your instructor and textbook. It's participating in all the skills during the day. It is putting the skills all together in a mega code and in a post-test. So if you really prepared yourself with the pre-test, you should do very well with the post-test. To be honest, the written test is not difficult. It's really being able to participate in the class and show the instructor that you are prepared and you know most of it. So I hope that's helpful for you in taking your ACLS class. There's similar stories to tell you with you taking pediatric advanced life support. It's the same type of routine, and again with the basic cardiac life support class. So just remember, if you're taking one of my programs, make sure you get the password to download the study guides. And any one of you could feel free to email me or call me with any questions you have about any of the programs. So thank you for your time. I'll see you soon.